Good morning. Thank you all for joining us today for this media availability. I'm joined today by Dr. Graham Snyder, UPMC's Medical Director of Infection Prevention and Hospital Epidemiology, by Tammy Minier, who is UPMC's Chief Quality Officer, and by Dr. Don Yealy, who is UPMC's Senior Medical Director and the Chair of Emergency Medicine at UPMC. They will briefly update you on COVID-19 in the communities UPMC serves and how that continues to inform our actions. After they give their remarks, we will take your questions. Dr. Snyder.
Thank you. For slightly more than 2 weeks now, we've seen the number of people test positive for COVID-19 in Western Pennsylvania increase significantly. Our testing data, and that of our partners at the county and state health departments, indicates that these cases are largely linked to younger people who contracted the virus either while traveling or while socializing without masks or proper distancing. The median age of those testing positive in Allegheny County is under 30. This is the pattern I'm seeing everywhere I look. Patients, healthcare workers, public health data, colleagues, neighbors. The current positives are showing up in young, healthy people exposed in the community setting. We've learned that this virus is not as severe in this age group. This is reflected in our hospitalization data. Our hospitalizations have seen an increase, as would be expected. System-wide, we have 118 people hospitalized. The average age of those hospitalized is over 60. While the absolute number of these hospitalizations is up a bit, the rate of hospitalization has not kept pace with the rate of growth of positive test cases that we're seeing. We would expect to see more patients with severe lung disease and needing ventilation, but the patients that we're seeing, the severity of illness that we're seeing, is not matching what we are seeing with the hospitalizations. So despite the fact that hospitalizations are only accounting for a little more than 2% of our patient population, it's telling that the intensity of the disease that we're seeing in our hospitalized patient is not matching that. We're also not seeing the same mortality that we're seeing in the spring at the emergence of the epidemic, or in any of the communities that UPMC serves, nor in the numbers that we're seeing by the county or state. Finally, our asymptomatic positive rate is holding steady at 0.27%. With rising cases, it would be logical to expect more asymptomatic positives. We believe we are not seeing this because we are testing patients coming in for medical procedures, and this population skews to an older age. My responsibility is keeping patients, visitors, and healthcare workers safe from infections when being seen in our facility. UPMC does not take this new rate of positives lightly. This is serious, and we believe it's important to share the facts. Right now, the data indicates that we as a community are doing a good job protecting those who have learned or are most vulnerable to bad outcomes from COVID-19, the frail elderly and those who are immunocompromised. And the infection prevention measures we're taking in our hospitals are working. Our staff are following the policies, and this rise in community-acquired cases is not compromising patient safety in our hospitals. Masking all day is not convenient. I recognize that. But our healthcare workers understand the importance, and for that, I thank them. We need to keep this up. One of the best ways we've found for the public to help is to follow public health guidance and wear a mask in public spaces. Stay home if you're not feeling well, and wash your hands frequently. If you test positive or are notified through contact tracing that you've been exposed, take the quarantine and self-isolation instructions seriously. Do not go out and expose others.
Thank you, Dr. Snyder. Throughout UPMC, we have kept abreast of the COVID-19 developments and responded accordingly. For example, when it became clear early on that we would likely see cases in our community and there were no other options available for testing, we developed our own COVID-19 test and provided it to our communities well ahead of anything being available commercially. We then expanded our specimen collection sites throughout Central and Western Pennsylvania, as well as New York and Maryland. We also provided testing within our hospitals when needed and provided on-site testing at our senior communities and in other locations in the community as needed. Today, we're sharing that we've added drive-through testing at our Southside specimen collection facility. I've been so proud of how smoothly and efficiently our specimen collection has worked within this facility and how professional the staff have been as they have put patients at ease. We're now adding this drive-through testing to accommodate the additional demand for testing in Allegheny County. Like Dr. Snyder, I also want to stress the importance of wearing a mask, not only in public spaces, but in all UPMC facilities. Early on, we worked with our suppliers to secure enough masks to give them to all of our staff, to patients and their support persons. We believe in the importance of having a support person accompany our patients to the hospital if they wish. I thank those visitors who always wear a mask and wear it correctly. If I can see your nose, I know you're not wearing it properly. Masking within our facilities is very important. If you notice someone not doing that, please alert a member of our staff. Our facilities are safe and clean, and we are employing the latest evidence-based infection prevention practices to give our patients the confidence that UPMC will provide them the world-class care they need whenever needed. Dr. Ely.
Thank you very much, and thank you all for attending. And I thank Graham and Tammy for being fabulous partners here in our UPMC experience through this COVID-19 pandemic. You've heard me say this before, but it's important to repeat now again. Please don't delay your health care because fears of or from COVID-19. If you're due for a preventative care visit, like cancer screening or even a simple annual exam, don't cancel it because you fear getting COVID-19 illness or infection. As we just reviewed, our care sites are safe, our staff is well-equipped and well-trained. Delaying care is how little issues and small problems become big issues and big problems. If you think you might have a medical emergency, such as early signs of a heart attack or a stroke, or if something's just not right with your child, go to the emergency department. Don't hesitate. We are ready to provide life-saving care for you and for your children. We want to help you get better. The ED is safe. In early spring, our policymakers enacted broad social limits to help flatten the curve. That is, spread the infection transmission out over time to allow the healthcare responders not to be overwhelmed. We can avoid returning to that if we all do the simple things that are proven to help prevent the spread of the COVID-19 illness or infection. Wear a mask in public, always. Wear it properly. Cover your mouth and your nose. Stay home when you're sick, and stay home if you can. Large congregations put people at risk. Wash your hands and stay extra vigilant to protect the elderly and others who are vulnerable. You can't always tell from looking who's vulnerable, so follow these simple steps always. We stress to our healthcare workers that they have a responsibility to follow these exact same guidelines. That applies to the general public also. The virus will be with us for the foreseeable future, but as Dr. Snyder pointed out in sharing our data, despite more people testing positive, often younger adults, we are not seeing the same pattern of increase in severe cases. And I believe we can keep it that way if we focus our efforts on protecting the frail, the elderly, and other vulnerable. That means all of us doing it all the time. We don't want any avoidable infections in anyone, but we must stay especially focused on doing the things that keep everyone protected, including the vulnerable people that you actually can't tell.
Okay, thank you, doctors. Thank you, Tammy. And now we'll take questions from the media, all of whom are joining us remotely online. Again, to ask your question, you'll have to go to the participants icon at the bottom of the page and press the raise your hand button. That will put you in the queue. I will read your name and your line will be unmuted for you to ask the question. please make sure to unmute your microphone as well. We'll try to call on as many different media outlets as we can in the time that we have allotted. I do have a couple of email questions that I want to get to first as you're going through the process of raising your hand. First email question is the following. Is the recent increase in the number of positive cases we're seeing more or less severe, or perhaps better stated, more or less concerning to you as compared to April and March? Are you seeing changes in the virus? Dr. Snyder, why don't we start with you?
That's a question that UPMC is able to provide insights into because we do our own testing. We are clinicians and scientists, and it's vitally important that we describe the reality of the outbreak to inform policymakers and public. There are multiple reasons why an epidemic may wax and wane, and the nature of the virus itself is one of those reasons. You may have heard in the news that there's a dominant global strain, one that seems to transmit easier but is less deadly. That's the strain we're detecting, and our data supports those characteristics. Additionally, we're finding a lower viral load, meaning less virus within the person in the samples that we collect from our patients for testing. We don't know for sure why this is, but suspect that seasonality, particularly humidity, impacts virus transmission.
If I can add on a few things. We know that the virus presents us with essentially a moving target. It's disrupted things everywhere in Western Pennsylvania, in all the communities that we serve at UPMC, across the United States and across the entire world. Our approach at UPMC has been to use the best current experience and scientific data and be prepared based on predictions and experiences elsewhere to deal with what happens in our communities. This will change over time, and it already has changed. Despite the increase in cases, we remain very fortunate in all the communities that we serve, but particularly here in Allegheny County, compared to other places around the country, especially in the South. We've taken precautions and proactive clinical interventions based on our scientific understanding, and we're confident that we can keep that up and remain in a good position.
Okay, thank you. The next email question before we get to your questions is as follows. We've heard that you have lots of employees out on quarantine. How can you tell us UPMC is safe when your employees are getting sick? Tammy?
Thank you, Paul. That's a great question. Our employees live in the communities where our many hospitals are located. Like any people who live in a community, some of them do contract COVID-19. When any employee tests positive, we do a very in-depth contact tracing to identify any staff who had direct exposure with that individual, and they are quarantined at home with pay. Further adding to this safety are the policies that we use for equipment, infection prevention, and other measures that the staff use within the hospital. So the basics of keeping our patients safe, we implement always. And masks and the basic prevention tools that we've talked, all three of us today about, are really critical to keeping us safe. So thanks for the question, Paul.
Thank you, Tammy. Let's go to Paul Goff, Pittsburgh Business Times. Paul, go ahead.
Hi, thank you very much for the time. What's your thoughts about going back to school? As a parent, talking to parents, kind of wondering about whether it's safe to go back, district by district, and what steps do you think should be taken to ensure safety on those matters?
Well, we think that education is an important part of not only our children's development, but our whole societal set of interactions. And we understand that people have concerns about how do we bring this group back into closer contact and do it safely, not only safely for our children or our young adults that might be in high school or college, but for the people they interact with at school and at their homes. And we think the basic core principles that we've outlined will be a large part of the advice and the actions that have to be taken at each individual school and school district. We've tried to partner together to create some of those guidelines to help those individual settings, all of which have different populations, different physical layouts, learn how to do this best. So we're here not to make the decision for school districts or for policymakers, but to help people understand what are the best steps to achieve the goals that they want. We know that eventually our children have to return for education, and we know that socialization is an important part of it. What we'll do is adapt to the realities, and we'll help provide the advice that guides that.
Next question, David Kaplan, WTAE-TV. David, go ahead.
Hello, thank you for your time today. I have two very quick questions. The first one, just your reaction to what we're hearing about Allegheny County regarding indoor dining and requiring restaurants to have outdoor dining, limiting alcohol sales. Do you agree with the actions that Allegheny County has put in place and similar things that we could see in outlying counties? That's my first question. The second one is just about testing writ large. Pennsylvania has the 6th highest positivity rate in the country and is number 46, I believe, in terms of testing. Are we lagging in Pennsylvania with regards to tests, and do we need to be doing more tests?
I'll start.
Yeah,
We
please,
work
Graham.
together with our public health partners to take care of patients and healthcare workers and visitors in a lot of UPMC communities, not just Allegheny County, and so have to adapt to the circumstances that are happening in the county. While our public health colleagues are working on the public health interventions, such as what practices are happening in restaurants, schools, sports, et cetera, we contribute to that effort by adding our expertise of what we know about the virus and transmission, and partnering those interventions with how we keep people safe in the hospital. And how we keep people safe in the hospital is the same no matter how intense the level of activity is in our communities. And whether you're in the hospital or in the community, the fundamentals are the same. Stay home from work or school if you're sick. Do what I do. Be so familiar with wearing a mask that you forget to take it off when you no longer need to be wearing it. And wash your hands. And we need to be cognizant of those who are vulnerable, the immunocompromised and elderly, and be particularly attentive to the risk that they may face.
I'd like to pick up a little bit more. The beginning part of your question is, what do we think about some of the public health initiatives? And I think I'm very impressed with how the Allegheny County Health Department, the local county health departments and the other communities that we serve, and the Commonwealth have been trying to gather information not only from their sources but from providers like us, and trying to shift into more of what we would call a precision public health approach. And I'm impressed, and I think Dr. Bogan is making her decisions based on all of that information and trying to target interventions a little bit more precisely. So as a general statement, while I can't comment on any specific particular proclamation, I am impressed that we're trying to do things smarter and effectively, and I think we should all be supportive of that. I don't think anyone wants to go back to broader-based shutdowns because it's very difficult for all of us.
Yeah. And I would like to chime in a little bit on your testing comment. There is absolutely no doubt that as a country, we still need more testing. And our laboratory manufacturers who support all of the healthcare delivery systems across the United States are really trying very desperately to step up and find quick, easy, fast tests that will allow us to have answers as quickly as possible that we all really are striving towards. I'm incredibly proud of the work that we began here and know that UPMC continues to do more testing than any healthcare facility that certainly I'm aware of at this point in time in our region. The rest of the testing locations and our partners with Quest has been phenomenal in working to increase their capacity, but we would 100% agree with you that having more testing capacity is critical, and it's also why we've stood up more specimen collection locations. Testing and specimen collection often get commingled in language, and they really are two separate steps. We need to gather the specimen to then run the test, and there are very specific requirements to keep people safe, the patient and the employee who's gathering the specimen, that we critically adhere to at all times. So thanks for the question.
And one final comment about testing. Testing is a really important part of how we're going to manage everything within this pandemic, but it is not the singular most determinative issue, particularly if you're not symptomatic, you haven't been directly exposed or haven't participated in risky behavior. What's way more important are the simple things that we keep talking about. Wear the mask all the time, indoors and outdoors when you can't have physical separation. Do physical separation. Try to avoid crowds. Wash your hands. Don't go out sick. That is far more important than having testing in the absence of any particular other indication for it. And let's not lose sight of that.
Okay. Next question comes from Bill Kibler at the Altoona Mirror. Bill, go ahead.
Thank you. Do you have any thoughts on why COVID-19 has generally required a higher percentage of Black people to be hospitalized compared to white people?
Graham, you want to chime in?
And that's data that we've looked at here at UPMC. We want to be very cognizant of supporting our communities and making sure that we're providing care and testing, specimen collection and testing opportunities for everybody in the community. There are a number of factors about the virus that may lead to different rates of either hospitalization or care outcomes. I think at UPMC we're providing the right level of care for all of our patients, and we're not seeing those same trends in differences in care and outcomes that are being reported, but we're remaining cognizant and observing for those.
Yeah.
Yeah, if I can add on to that, our experience at UPMC is that Black patients are actually admitted at a slightly higher frequency compared to the population and compared to white patients, but the outcomes are just as good as any other group of our patients. And really that's what we focus on the most, is meeting you where your need is and getting you back to health as quickly as possible, not so much how you got to that point. Of course, there's lots of social determinants that can influence whether or not you get infected and how you do with that infection. Our job is to, once those exist, to try to, over the long haul, address those. But when you have an acute illness, to make sure you get the care that you need no matter what.
Thank you. Next question, Brian Rittmeyer of the Tribune Review. Brian, please go ahead.
Hi, thank you very much. Can you hear me okay?
Yes.
Okay. Can you address the studies and reports showing a link between blood type and susceptibility to contracting COVID and impacting the severity of the illness? And does UPMC have any firsthand data or experience with this?
We're going to learn a lot about the virus biology that adds to the literature we already have. And the relationship between the blood type and outcomes with the virus, or the ability of the virus to cause disease, is an important lead that will fall. I think from the perspective of all of us out there as individuals in the community, the fundamentals that Don and Tammy and I have been talking about and that we hear from our public health colleagues are the same. And we wouldn't do anything different right now to protect individuals based on their blood type alone. Additionally, we don't yet know that there are treatment or patient management differences that would benefit one blood type or the other. So it's something scientifically we want to continue to explore and may help explain how the virus causes disease for us in individuals, but that information doesn't change how we protect ourselves, protect those in our communities, and take care of our patients.
Okay, thank you, Doctor. Jamie Bittner, WPMT TV in Harrisburg. Jamie, please go ahead. Jamie, unmute your microphone.
There you are. Hello, everyone. There have been new calls in Harrisburg to end the governor's disaster declaration, and I wanted to know what your thoughts are overall on the pace of this reopening and the message that it might send if that declaration would be called off. And number two, I was also wondering if you had any updates on how your studies have been going on the treatments for COVID-19.
So first you asked about what are our views about the disaster declaration by the governor and what impact any particular change in that might have. The governor's disaster declaration created a lot of opportunity for healthcare systems and individual providers to respond to the needs, and I congratulate the governor for that, for making our jobs essentially more doable. If there is a change in the disaster declarations, it's fully our expectation that they'll evolve into more, again, precision interventions. And I don't think that that's necessarily a bad idea. I can't speak to what those might be, and they'll likely be based on data. Our job is to make sure that we interact closely with the governor, the Secretary of Health, to make sure that they understand our needs currently, what we anticipate, and we can inform whatever policy decisions that they make. I'm completely comfortable that we have those kind of communication channels open. You also asked about the research. So UPMC participated in one of the largest hydroxychloroquine trials. You remember that was one of the agents that early on had lots of positive thoughts and activity around it, and over time has had less positive activities. We completed a trial. We will be releasing, along with the other institutions across the country that were part of this, the results of that. We think that the public is best served by having those results released when they've been through the full scientific rigor, not in press releases in advance, because that's really driven a lot of the science. One of my partners here at UPMC just wrote a piece about the challenges of doing really good research that truly informs us, tells us what helps and what doesn't, and doing it in a time when people really are desperate for information and being wary of getting information that's not fully vetted out before that has had a chance to happen. It's how we get into positions of using things that either help or underusing things that we know that can help. So we've participated in that. We're continuing to study steroids. You've heard about dexamethasone. That's ongoing. We know part of that story. We're part of the remdesivir. That's a drug that fights the virus specifically. And we have, as you heard through our REMAP platform, a variety of other interventions either ongoing or about to be launched. We want to be part of creating that knowledge. It takes time. It's not something that you can get an answer within weeks or even a couple months. We want to do it right, not just quick.
Graham, you have anything you want to add?
Well, I would second what Don says about releasing good science. And we have, our colleagues at UPMC have a scientific philosophy that we want to contribute sound data to the literature. One of the interesting phenomena of this epidemic has been the profusion of publications that have come out. We have seen some retracted. We have seen some with some preliminary data that then with the full panel of data have given us a different result. When the people at UPMC, the scientists and clinicians at UPMC want to offer data that can contribute to our understanding and response to this virus, we want to make sure it's sound, meaningful data.
Great, thank you. Next question, David Templeton, Pittsburgh Post-Gazette. David, please go ahead.
Okay. With all of these increases in case numbers, there is a lag time on hospitalizations and deaths. And even though this is a younger cohort, that means that there may be more infections when they go home with other family members. Is that lag time kind of hiding the fact of the real impact of this resurgence?
That's an excellent question. And what you're asking is, what is the relationship between increase in positive tests and cases and the more severe forms? So we know that severe illness, and particularly illness that requires some sort of assistance with your breathing, we call that ventilator use, and death can increase, and it often lags behind when there's a growth in positive cases. So we know that that's a possibility. We're now about 3 weeks in Western Pennsylvania into seeing an increase in the number of positive cases. And we have a lot of experience and a lot of data here. We expected that we'd already begin to see some of the uptick in severe illness, keeping a similar pace, maybe not identical, as in the number of cases, and we haven't seen that yet. Yes, we have more people admitted, but the severe cases in the intensive care unit on ventilators have not grown anywhere near that proportion and are way beneath the proportions that we saw with our first experience with COVID-19 illness and infection. That doesn't mean we won't be prepared. That doesn't mean we aren't prepared. That doesn't mean it couldn't still happen. It means we're responding to the realities that they exist right now. And we're optimistic that if we stay on track with this and we convince everyone, particularly those young people, even if previously they made some risky decisions about activity, going out, not having masking or distancing, we think that if we work together with our public health partners, that we can actually keep this the way it is right now, which is limiting severe infections, those that need intensive care, and limiting the number of people who actually have to go on to have the worst outcome, which is death. We can protect people. We need to stay focused on the vulnerable populations while everyone is doing the simple actions.
There's a very important point that embedded with you, that you astutely put in your question, and that is, if you're a young person and you hear the message that the virus is changing or that young people don't have as severe of disease, those may both be true. But that doesn't mean that young people don't play a very, very important role in our communities. And that notion that embedded in your question was that, yes, you may be less likely than somebody who's elderly in our community to have a severe or unwanted outcome from the infection, including death. It still means that you can impact those around you, which is why we come back yet again to these really, really important key messages of stay home if you're sick, mask when you're out and in congregate settings, hand hygiene is critically important. All of these are really important, not just for protecting ourselves, but protecting those around us.
Thank you. Danny Fitzgerald, Beaver County Times. Danny, please go ahead. Danny, take your speaker off mute.
Can you hear me okay?
We got you now. Go ahead, Danny.
Okay, great. Sorry about that. Yeah, my question specifically for in Lawrence County, for at Jameson, UPMC Jameson. I don't know if you have experience with them, how they're handling the rise in cases. I know they didn't really have a whole lot, comparatively to Beaver County and Allegheny County months ago, but now they're seeing a rise in cases. Just wanted to see how they're handling that, if you have any thoughts.
I'm exceptionally proud of UPMC Jameson. They have responded beautifully to the demands and the needs of their community. The facility and its clinical leadership are ready, able, following all of the protocols. And while they've seen some very small increases, they are not of any significant number. We monitor this, as you know, continuously, but I could not be more proud of them as a facility and the work that they have done. So steady as we go.
I'd like to add to Tammy's answer. UPMC Jameson is part of UPMC. And right before I came to this press conference today, I was on a conference call focused on UPMC Jameson and their nearby facilities to make sure they have the education, the training, the equipment, the capacity to continue doing the excellent job that's already happened there. So I'm completely comfortable with the level of care and the kind of care that's been given at all of our sites, and in particular in Lawrence County.
Okay, thank you. We have time for about 3-4 more questions. We'll try to go fast. Holly Patterson, Greenville Record Argus. Holly, please go ahead.
Good morning. Can you hear me okay?
We can hear you, Holly. Please go ahead.
Thank you. My question is concerning asymptomatic patients versus symptomatic patients and contact tracing and how that is being conducted, and is there a difference, and what should asymptomatic patients do after they have been tested and have been positive, as compared to how they can affect their community and their family?
Yeah, first and foremost, as we said earlier, it's important to listen to the guidance that, as an individual, that you get from public health when you're contacted about contact tracing and isolation and monitoring afterwards. Something interesting about the virus that we've observed for quite a long time and are responding to is that this is a virus that readily transmits even among asymptomatic people. In other words, we don't always see with infections, we don't always see people who have asymptomatic infections. A lot of infections we generally see present with symptoms the vast majority or even all of the time. And B, when people are asymptomatic, they are at risk of transmitting to other individuals. It is also true that we don't know exactly the likelihood, if you're exposed to the virus, that you would be symptomatic or asymptomatic, and there's probably not one number for that. It probably depends on a number of factors, including how much virus you're exposed to, your own personal body health and biology, the conditions that you were exposed to, the virus itself, etc. We also won't have one number on how likely it is to transmit if you're asymptomatic, but people who are symptomatic are more likely to transmit than people who are not symptomatic. So what does that mean to the second part of your question about what we do differently? The answer is, if you have the virus, whether you're asymptomatic or symptomatic, it's important to take the same precautions about following instructions for self-isolation, because contagiousness can happen in both situations. Additionally, we've learned that people can be contagious for the couple days before they develop symptoms. So even if you find that you are what we call an asymptomatic carrier, it means you have no symptoms but you have the virus, you may still become sick. So there, and be contagious before you develop symptoms. So together, while this is a useful distinction from a scientific perspective about the virus, and is important to us as we do contact tracing, knowing that asymptomatic people may transmit the virus, the recommendations to protect those around you remain similar.
If I could add one other statement, if you're contacted about a tracing from either a symptomatic or an asymptomatic patient, let me ask that you really participate. We've heard reports of people who just won't respond to some of these requests. This is beyond just Big Brother watching you or a personal rights kind of issue. This is how we protect all of us, including some people who you may have come in contact with who you can't tell whether or not they're vulnerable. Do the smart things that we talked about, and if you have the opportunity to give information, I really would ask that you help us fight this disease together.
I'll add also a second idea to my first response. Another important element I want to add. As Don alluded to earlier, we will never be able to test everybody often enough to have complete understanding of who has the virus and who doesn't. We just will never, it's never even going to be logistically feasible to do that. So what that means is that it's possible that somebody has the virus and doesn't know it. And from our own data, as I presented at the top, from patients who are coming in for procedures that we do asymptomatic pre-procedural testing, we know the likelihood of that in our communities is 0.27%. So it's a small, small number of people. Nevertheless, that's possible. How do we protect ourselves against that? It's going to sound familiar. Wearing your mask, hand hygiene, and if you have been in contact with somebody who's sick, making sure to follow the public health guidance about isolating.
Great. Next question, Sarah Bowden, WESA-FM. Sarah, please go ahead.
Hi, Dr. Snyder. I was hoping you could follow up on your comments about the fact that it appears that one of the strains of the virus seems to be less lethal. It's my understanding that research is very new and somewhat inconclusive, and we don't know that for sure, but of course I'm not a doctor, so I was hoping that you could maybe talk a little bit about what we actually do and do not know about the lethality of that strain.
So we have a lot to learn, and we're learning a lot already. What's happening, what appears to be happening with this strain of virus is that it may be more readily transmitted, but may be less likely to cause serious outcomes of infection. In other words, we're less likely to see somebody require a ventilator in the hospital, for example. So we are interpreting those studies on the biology of the virus and the genetics of the virus itself in the context of what we see from our clinical data. And while that's important for us to help understand how the virus is transmitting in our communities and may add to the potential to predict what's happening in the future, although that's notoriously difficult for ourselves, at the moment it doesn't change the fundamental protections that we take if you're a patient that's come into our hospital. And I think it's important for us as UPMC scientists, clinicians, epidemiologists to provide this information so from a public health standpoint, our colleagues can guide the public health interventions that they put in place to protect our communities.
And to add to that, Sarah, the virus may change over time. The clinical patterns may change. What we'll do is share with you what we see about this. And we'll all recognize that our insights into either the biology of the virus or how people interact with each other and how that affects our experience, we'll share that with you, and they will most certainly evolve over time. It's not so much a right or a wrong issue, but it's about continuous and better understanding of what's happening from the virus level up through the individual cells in our bodies through our clinical experience with that.
Okay, next question, Tom Davidson, Tribune Review. Tom, please go ahead.
Hello. I wondered, especially in light of the guidance to avoid congregate settings, what you thought about Kennywood, Idlewild, and other amusement parks reopening, some of them tomorrow and others next week. If you had any guidance for people that might plan to go there, it's one of those situations where it might be tough to wear a mask or to avoid being in close contact with people.
Well, once again, there are lots of factors in play here, and there are many places where congregation is possible. That means those places will have to focus their activities when opening or reopening or re-engaging more on how to achieve the principles behind that and how to achieve the safety. And what I'm certain about is that between the public health requirements, the education, and some of the expert advice they get from us and from others, that they have the opportunity to respond to that. It's not a yes or a no issue. So you mentioned a lot of outdoor places. I can easily see how they may be able to achieve the distancing and many of the other activities with careful planning and execution. The hardest part is to transform a plan into actions that happen day in and day out. And that's where I suspect that they're going to focus their activities.
And I would add, too, I think, Don, your point about sustainability is really the issue. As we've all come to appreciate, we are now learning how to live with COVID-19 and how do we adapt and adopt on a daily basis, frankly, what is the ongoing science, the ongoing information that all of us are hearing and wanting to keep ourselves and our community safe. And so I think the vigilance is not only in the precision policies, as Don has mentioned, but in the ongoing leadership to oversee and make sure that those practices are sustained over time as we continue to strive towards solutions.
Okay, thank you. And our final question, Craig Meyer, Pittsburgh Post-Gazette. Craig, please go ahead.
Yeah, hi. Can you all hear me okay?
Yeah, we got you, Craig. Please go ahead.
Oh, perfect. This is a time of year where you have high school athletes returning to their sports and their teams with various workouts and practices. I was curious if there were what practical or medical concerns that you all may have when it comes to exercising in masks outdoors in very intense heat. And if you do have such concerns, what are some recommendations that you would make to, I guess, mitigate any of those problems?
Mm-hmm. You want to start, Graham?
Yeah, I'll start by commenting that we have a great group of individuals who, even before COVID-19, partnered with various levels of sports activities in our community to provide sports medicine. And we've translated that partnership into the UPMC Return to Sports Playbook, which we've made available online. And that helps to provide some guidance to everything from the smallest little leagues to professional sports about how we might resume sports safely. So the issue with masking and the heat is an important health issue. And it's a balance between how can we prevent transmission and at the same time watch the safety of our athletes. I think part of that answer is a sports medicine answer in that how do we do things like ensure enough water breaks, enough pauses to activities for people to remain cool, and at the same time do it safely in a way that doesn't prevent transmission. So put differently, the requirement to wear masks is not necessarily incompatible with keeping people well while they're participating in athletics.
And as Graham mentioned, the Return to Sports Guide is out and available publicly. So for our partners who have not had an opportunity to take a look at that, it really is an exceptional, in-depth resource to help guide some of those decisions that UPMC has made available to all communities. And we encourage you to take a look at it and download it for your use.
Okay. Thank you very much. So in about 45 minutes, we will email media attendees a link to download a high-definition footage and high-definition photos of this entire press conference. And that's what we encourage you to use in your news reports. Reporters with follow-up questions are encouraged to contact our UPMC Media Relations Department at upmc.com/media. And please follow at UPMC News on Twitter for updates. Again, thank you very much for attending and enjoy the rest of your day.